Hey, how's it going?
It's going. All graduated up and everything, and I feel like a big girl now.
So for our audience, can you go over what you're graduated from?
I'm a recent graduate from the University of Phoenix, and I was specifically studying mental health and clinical counseling. This is not my first and only degree with the University of Phoenix. I also have my associates in the arts of psychology. And then I also have my bachelor's in science and human services with a concentration in management. And then I further propelled myself into, going into my master's of clinical counseling. So I'm not quite sure if you want to hear the reason why I got into the clinical counseling
Absolutely.
and mental
Share with
health aspect.
everybody, your aspects of, why did you decide to do this? Because as you just said, you have been with the university, but through several different aspects. And it sounds like you have gradually kind of stepped towards this area. Is that right?
Oh yeah, definitely. I will definitely say that it has been gradual. I kind of went back to school on a whim because I was bored and I was thinking about things that I was interested in. I am very interested in psychology. I think that's pretty obvious now by my choice of studies. But I was bored and I'm like, okay, well, let me go back to school. So I did that. And then I'm like, okay, well, there are a lot of places in South Carolina that won't hire you unless you have a bachelor's or master's. So I went on to my bachelor's in science and human services. That's a pretty wide field right there, but I was more interested in the mental health aspect of human services. So, and through that program, we were required to do 2 internships, and I got connected with an amazing organization, and I'm totally gonna pimp them out right now. It's the Low Country Firefighter Support Team. What we do is we provide a variety and range of services to first responders and their families. And when I started, I was like, okay, cool. So I'm learning about all the different services that we provide and just kind of navigating my way through. We do mental health services, financial services. If a first responder is in the hospital, we would go and make visits with them, make sure their families had everything that they needed and that they were well taken care of, because who's going to take care of first responders? First responders take care of the community. So I was like, look, this is, a really big thing for me to be able to give back to this population. And through my journey with the support team, we started to expand in the other first responders that we serve. We now serve not only firefighters, we also serve paramedics, EMS, and dispatchers too. Dispatchers are kind of like the real behind the scenes people, but we started to recognize that, hey, they need, support as well. So we branched out from there. We have a couple different programs that we run, and one of them is called Operation C. And what we do is we make, not we, myself, but individuals on our team, they hand make weighted blankets, and we specifically tailor them to the individual's height and body weight and everything, to make sure it suits them. Because if you go to Target or CVS or Amazon or whatever the case may be, they have just a general, you can pick from 3 different sizes or weights. So we tailor it and really suit the need of our first responders. So we also in the dispatch centers, multiple dispatch centers, we have donated blankets to them. So if a dispatcher gets a really distressing call, another first responder is injured, it's a severe accident, or even something involving a suicide or an accident involving a child, those dispatchers, a lot of times, 9 times out of 10, I'm going to say, they never get closure to a call. So they're left hanging there not knowing the outcome of the situation. So we, kind of branched out and we're like, oh wow, our dispatchers need some, TLC too. So we kind of branched off to that as well. So that in itself is absolutely amazing, because the dispatchers are really the first people that you come into contact with before you meet your first responders, whether it's the fire service, paramedics, or EMS, or even law enforcement. So we were like, okay, they need, the TLC too. So we branched out to that, and it's actually been extremely successful. So, and then kind of backpedaling to my educational navigation and journey, I discovered that we have a team of clinicians that provide mental health services to our first responders. So I was like, I want to do that. I want to be part of that. So I went and I was like, okay, I'm going, I let them know, hey, this is what I want to do. They're like, oh, wow, awesome. So first and foremost, they were really taken back that I wanted to do my second internship with them. I was like, look, you guys are stuck with me now. You can't shake me. This is something that I've grown to be extremely passionate about. And honestly, I can't see myself doing anything else. It's really, providing these services to a population that sometimes really gets ignored. So I thought it was extremely important. And I also discovered that through many of my cohorts and programs, I was the only individual who was interested in doing trauma, working with trauma. So that, kind of pushed me a little bit to start, pretty early on going to like seminars and everything. So I've done a few seminars through PESI, and I definitely recommend them. The information that they provide is absolutely amazing. They have so many resources as well. And some of the trainings that I've done with them is for EMDR, which is eye movement desensitization and reprocessing, that is used when treating trauma. It can be used with a couple other diagnoses as well. And I also have training in CBT, cognitive behavioral therapy, as well as DBT, which is the dialectical behavioral therapy. So I kind of wanted to gain as many skills as I possibly could through this journey. And I will definitely say that it has been extremely beneficial to me, not just with kind of making my own gains, but also gaining a better understanding of what we are learning in the classroom. Because I'll be completely honest, sometimes the class and the material in the coursework, it only really scratches the surface. So I definitely recommend that, if you're in these types of programs, start going to these seminars, learn as much as you can, because I have learned so much more about these different types of therapies and modalities that can be utilized for anxiety, depression, mood disorders, even personality disorders can be applied to. So it's just absolutely phenomenal, and I highly recommend it. I mean, definitely. You learn so much from the speakers, and you also learn from other individuals who are attending the seminars as well. I've met nurses who have attended seminars, individuals, social workers, caseworkers, some individuals in law enforcement have attended some as well, because they want to have a better understanding of the different populations that they serve too. So, and I think that is absolutely phenomenal in itself, that we have all these individuals from different areas, fields, and disciplines as well that are like, hey, I want to learn more, or I want to grow my skills, or I want to learn something a little bit different, or a different way to apply it. So, and when I attended my DBT seminar, I was working at an inpatient facility, and we had gone over one of the, I guess you could call it an exercise of chain analysis. And some people were like, I don't really see how I could use this with kids. I was like, oh, I do. I definitely can. They're like, okay, well, how would you utilize that? So what chain analysis is you're basically taking the end result, like, okay, so you have your end result, which is probably going to be negative in some way or another. And you kind of backpedal and see, where everything started, and you understand like different triggering events, and you can almost say, okay, if this happens again, I can do this instead of this and have a different outcome. So it's really how you process it as well. So it kind of, you can make things your own. And that's what I love about like DBT and CBT. You can
Before you do go on, though, I did want to kind of go back to what you were saying. So for the audience, they might not be completely understanding of exactly what that chaining is. So there's different types of chaining, like you said. Usually in the type of crisis situation, it would be that. But a positive one, I just want to quickly go over a positive one, would be someone who is like autistic, intellectual disability, for instance, brushing their teeth, doing the dishes, learning to dry it first, and then going backwards, and then learning the routine. So that would be a positive for the training sequence. Now, what you're talking about with the triggers and that's very important. And that's actually something that me and you both had learned through crisis. And that is really the antecedent, really what we would say what happened beforehand, right? And then we would look at the behavior itself, because behavior is not good nor bad. It's neutral until you put it in the context or context
Absolutely.
of what's going on. And then, like you said, the last part would be the C of it, the consequence. So what happened after the fact? And then you would go back through and say, okay, this is what happened, when it happened, where it happened. So if there's any kind of commonalities with the timeline, the time of day, the environment itself, who was around with them, that will be recorded as data. So then functional behavioral analysis person or a BCBA would then come in and evaluate to create that crisis plan. So just kind of an overview of what that looks like for the audience. So please do continue with your journey. And before we go on a little bit, I do want to get into the fact that, you know, you do have a job interview coming up, and it has to do with crisis.
Yes.
So I just kind of wanted to throw that in there for the audience. So please continue about your journey and your passion about crisis and mental health and being a fantastic counselor.
Oh yeah, absolutely. So another thing, kind of going back through and identifying, you know, what has really interested me is something that I've started to recognize with multiple clients as, you know, working through my internships and practicums, as well as being in an inpatient facility. I've started to notice that there's a trend a lot of times, individuals, you know, anxiety, depression, other disorders, a lot of times there's trauma behind all that. So it kind of goes through, and being able to identify that trauma and to work through that, you can effectively be able to identify other things like we've discussed, you know, with triggers. You know, it's like, okay, there can be so many different, you know, things. You've got a big thing with fire service is anniversary dates, and smells are another really big thing as well. So if you go through and you're able to identify some of these triggers, you can work through those events. I myself, I have experienced multiple traumas in my life. I won't go too much into detail with that, but I can say that being able to identify my own triggers and to work through that has been extremely therapeutic for myself. And I've gained a better understanding of myself and who I am. And it is also helped me to effectively, you know, work through this, because one of the big things for me was anniversaries. There was one particular event. I am a former first responder myself. I was an emergency medical responder, and there was an instance where I happened upon an accident. It was pretty severe. It was a moped and a motor vehicle, and this individual ultimately succumbed to internal injuries and did not make it. When I found out about it, I was really hard on myself. I did you know, I could have done more. I should have known, you know, and I placed a lot of blame on myself. And then I began my own therapeutic journey, and I was able to work through some of this. The anniversary is still pretty tough for me. Wow, I can feel myself getting a little emotional. Another big thing with that is I can remember the event clear as day, as if I'm watching a movie. And there were times where I would kind of go into like the fight or flight mode, and it's like I would get, you know, really worked up, or, you know, my arousal states would go through the roof, and I was just like, you know, I didn't understand what I was experiencing myself. So, and I really had to work through that. Oop, just a second.
Don't worry about it.
Okay. So, and working through that and being able to identify some of those triggers, one big thing for me was the anniversary, and smells. Smells will instantly bring me back to that moment, and it's almost like I'm reliving it. But being able to, you know, go through my own therapy and my own counseling, I have been able to process it in a really healthy way. And I no longer have, well, I can't say that I no longer have, but a lot of my negative emotions and cognitions about the event have decreased dramatically. So that in itself is, therapy is cool.
Right? That's fantastic. So I do have a question for you though. So
Mhm.
for anyone who has been experiencing trauma, has experienced trauma in the past, or is possibly even currently experiencing trauma, what advice would you give them as a previous trauma victim?
Oh, wow. That in itself right there is being able to identify. A lot of times people are able to identify the triggering event. Like, okay, it was this vehicle accident. It was a house fire. Even a pet passing. A family member passing. You yourself being in a situation where your life is put at risk. You know, Being able to identify the emotions that are associated with it can become extremely powerful to yourself. And then you can almost start to gain control over, I don't want to say the situation, but even the memories of it. Because, when you get those triggers, you can relive that experience all over again. And it's really working through that, but definitely, find somebody that you trust, a confidant. It could be, somebody with your church group, or, if you have a supervisor at work, that is very open eared to you, or even seeking your own therapy and counseling. Look for somebody who is informed in trauma, somebody who has that experience, and really go through that, reach out. It can be so difficult to pick up the phone or send that email, for the first time, because a lot of times what people do is, what I've noticed from clients, is it takes at least 3 attempts before they're like, okay, I'm ready for this, and they might kind of weed through other therapists. Some clients that I've had, they're like, I've, had multiple therapists, and it's like, okay, what did you like about them? What didn't you like about them? And a lot of what I'm seeing is that a lot of clients are like, look, the therapist was trying to be my friend. I don't want someone who's going to be my friend. Yes, I want somebody who's going to listen to me, who's going to be compassionate, understanding, empathetic, and just well informed, rather than, treating somebody like a friend. It's tough work a lot of times. I had therapeutic assignments, and some of them I didn't want to do because it was painful, but I knew that it was something that I was going to have to do in order to push through and to make my own progress. So definitely, trust in your therapist. And also another really big thing is, if you're not vibing with them, don't be afraid to tell them. You shouldn't be afraid to,
That's the process. You don't want to be with that person, then you have every right to be with the next one. You don't like that clinic, you have every right to transfer out. It is no different than your physical doctor in those aspects.
absolutely. So that's something that I definitely, want to put out in the air there. Don't be afraid to tell your therapist, like, hey, look, I don't think this relationship is working out. I've had clients tell me that outright, and I appreciate that more than anything, rather than continuing to go through this therapeutic process, and you can get stalled a little bit. And then, as an individual I've been called a therapist now, even though I haven't, been fully licensed yet. But as a therapist, I would say that I would much rather somebody outright tell me, hey, this isn't working out, or, I want to try something else. And it's like, okay, cool. If you're not vibing with me, let me know. Honestly, it is not going to hurt my feelings. And I take that, as a sign of respect as well. To be able to say, like, okay, I understand that this person is in this position, this stature, but there's something about you that I just really don't like. And it's like, okay, that's
Yeah,
fine.
you could very simply remind them of a family member that they're having trauma with,
Mhm.
and it really has nothing to do with you as an individual. It could be that you remind them of their dead sibling.
Mhm.
You remind them of their daughter they lost. There's many different things that are internal, and they
Mhm.
have no aspects to do with you in that way.
And a lot of times it's not personal at all.
Yeah,
So
that's what I'm
it's,
trying to get at.
yeah, so that's another really big thing right there too. So, but definitely, working, I don't want to say to work up the courage, but it does take a lot of courage to, make that first step and reach out, or even if it's just, talking to a
Any
close
type of
friend.
vulnerability, right?
Absolutely. Being able to be genuine and vulnerable with somebody is probably one of the best things ever, because it takes a lot of trust for somebody to open up and say, when I was 12 years old, I was brutally raped, by my stepfather and then beaten within an inch of my life. And my mother was afraid to leave him, and it's like, oh goodness, that takes a lot of courage for somebody to say, to pour themselves out and to like, look, I've experienced something awful and horrible. And in all honesty, no one should ever have to experience something like that before. So, and one thing that I've also picked up on that I would say to kind of shy away from is to uh to say something, like, I'm so sorry. You know, that's not something that you should apologize for. I can understand that it's a natural response. Like, I'm so sorry that you went through something like that. But I've noticed with some clients that they kind of start to backpedal, or, start to close up a little bit when you start going down that path. And to
Because
kind
you
of,
at that point see them as a victim, and they no longer feel that they can trust you. You have now put on the kid gloves, and they see that, and that's not what they're looking for. They're looking for someone to be true and honest with them because they were just true and honest with you. So I totally see what you're saying there on that aspect. But we do have about 10 minutes left, so I just kind of wanted to recap back to the job. And I know that we've gone real in depth with trauma, and I love it, but I kind of want to leave it there because it just gets deeper and deeper here. And we'll do another segment 2, on in-depth trauma, and we'll kind of go over, the different things that you've been, looking to create and things like that. So I totally want to do another video on that. But for now, I kind of wanted to double back to what kind of competition are you facing currently in this kind of atmosphere and job market, especially with the pandemic?
Oh, absolutely. It was a real struggle for me to get an internship, and I actually wound up going out of state, which was an amazing learning experience and opportunity for myself. I was able to grow and learn so much from the organization that I was with, and I was really able to continue to build on my skills. And one of the biggest things that I was continuously told is that how well informed I am with trauma and treating that and working with individuals who have experienced trauma. But to kind of go back to my competition, I have, there are multiple large big name colleges in my area. We've got the Medical University of South Carolina, we've got Clemson, we've got USC, we have Charleston Southern, we've got it is phenomenal. They have amazing programs, they really do. So I'm in competition from somebody who went to, it's a well-known university and college and program, but also I have to compete with these other universities and what these other individuals have gone through and experienced. So I'm in competition with some, big name institutions. And one of the bigger struggles that I also found is when trying to find an internship, one of the main struggles was, a lot of these placement sites, they had contracts with these colleges, and they were not willing to enter into another contract with another university because they wanted to serve the local colleges. I understand it. That's fine. I'm not mad about it, but it did get me a little frustrated, and it really led me to buckle down and say, I'm competing with these big fish now. I'm a little goldfish in the ocean with all these big sharks and barracudas and everything. So now I was like, okay, I've got to go above and beyond to really start to make a name for myself and to kind of brand myself. So I got more training and more training and more training, and I did a ton of research. So, and it was just, putting, the little seeds out there, and it's like, okay, I'm going to cast out my lines, and hopefully, my resume really stands out to somebody. And that's how
Yeah,
I wound
I
up
love that.
getting.
Didn't you have to get like additional like recommendation letters from people that actually practice in those areas, and essentially other things that not just the resume came with for you to even get this interview, right?
Oh, absolutely. I did have several letters of recommendation that I've had from previous colleagues that I've worked with, and also my academic colleagues. I don't want to say my fellow students, because we are colleagues at this point. So we're grad students, we're colleagues. So just definitely, really making a name for yourself and putting in the hard work and standing out to others, because that's something that you can really do to benefit not only yourself, but also clients in the future. Because if you put in the work, you're going to be recognized. And I had many individuals in my cohorts who are like, look, you're good at what you do. I've been told you're the best at what you do.
True champion.
Absolutely. So, and it's just having others give me that type of feedback, and also the feedback from the professors saying how well informed I am, or that I should be teaching a particular, model. And it's like, oh wow, so that kind of elevates
We'll get into
me
that
a little
another
bit.
video.
Oh yeah, absolutely. So that's another rabbit hole that we can go down at a later date. But definitely, having the letters of recommendations, getting additional training, and becoming informed, and also understanding the population that you want to work with. So trauma's been my thing, and that's been my main focus for, close to the 10 years I've been studying. So being able to identify right off the bat, like what population you want to work with, will also help you to stand out, because that's what you're going to drive towards. You have individuals who want to do marriage counseling, family counseling. They want to work with children and youth. They want to work with the LGBTQ community. Others want to work with refugees. All of these areas are very admirable, and, go with what you love and what you're passionate about. And my passion is trauma, really. So I wound up getting an interview for a crisis response team. So, and that is, I'll be covering, if I do get the position, I will let everyone know.
We'll do a celebration video.
Oh yeah, absolutely. But with that, right there is, I'll be covering several areas. It's a wide area that I would be covering, and it would be upstate in South Carolina. And I would be responding to individuals who are getting out of the hospital, who have been on psychiatric hold, individuals who are in active crisis. I would be responding to other calls that maybe paramedics, other first responders have, responded to, law enforcement, and to be able to work through that. And with this position, it would basically be doing assessments in the field, in real time, in the environment that they're in. So it's...
So for our audience who's not aware of what that means that this lady will come to you in the hospital and decide whether or not you're safe enough to be in the community, whether that's a homicidal issue, a suicidal issue, or anything in between. If you're doing self-harm or you're threatening people, this woman is the one that's going to be doing the documentation and working with the social workers, your doctors, your PCBs, very integrated. This is a very intense position. Most people cannot handle these types of positions. She will be seeing some of the most horrendous things, some of the most bloodiest, some of them hearing some things that most of us wish we could never hear. So to do that kind of position is very admirable, and she will be being the person saying whether or not you need to be on medication. She's going to be that person saying, nope, they need additional help. Nope, they have to have 1 step, 2 step, 3 step before they can be released. This is going to be the woman assisting you with all of those things. If you have a family member who is going through crisis, this is the lady you call, and she comes to assist. And it's not a one-time thing. It's prevention and intervention, which she helps throughout a duration of time, which generally will help someone going through crisis or trauma to become a very functional person in society within a few years. It is a hard process. It's not a process that's going to be right away. But because of the pandemic, these issues are more and more prominent. and these positions need to be filled with competent people. So I would have to say that I'm very happy that you were picked for that selection. I know it was a very intense selection process for you to even get an initial interview. I know that you will be moving from your home a more upstate. You've made a lot of sacrifices for everything you've done so far. So remember, to be a champion, you have to make sacrifices. But in the end, it's what you want to do. So with that, I would like closing statements from you.
Be an advocate. Be an advocate for yourself. Be an advocate for others. And I think that's the best thing that I can do, you know, during this time, is to be that advocate, because a lot of times they're individuals, they don't get that from friends, family, coworkers. They kind of get shunned because mental health in itself, there is still that stigma, and we really need to break it. And I don't want to say we do need to work on normalizing it, and for people to be okay and comfortable with saying, hey, I'm not okay right now. And one of my biggest things is it's okay to not be okay.
That's something we learned together long time ago. And we've always said, you know, it's okay to not be okay. It's okay to not be ready, especially working with trauma, special needs, people with developmental disabilities that might not have that cognitive process, or even drug induced. You know, with this pandemic, we have more and more abuse, more and more pandemics now. We're having fuel issues with fentanyl being overthrown through the U.S. and worldwide. So there are a lot more components, and not to mention the safety. We have to be wearing masks. So it's going to be harder to identify our clients. It's going to be harder to read whether they're going to be a threat to us, or for them to see they're not a threat to them. So I just want to say that doing any type of job that has to do with crisis, trauma, or any of those intense frontline type of things, kudos to you guys. We couldn't do it without you. And
absolutely.
you know,
and we definitely can't do it without our first responders.
Yeah, and you know, that's why we have the crisis treatment teams, which include those first responders specifically trained in crisis. And even more interesting and loving now, it's also been put into law for those special needs people to have that additional support of all of those teams.
Yes. So, and I did kind of want to add in, you know, on the end of this line, I will, you know, our national suicide prevention hotline, if anybody needs it, the number is 1-800-273-TALK, which is 1-800-273-8255. You are never alone. You are never alone. There will always be somebody there to listen to you. So just kind of wanted to say,
don't be worried about being judged, people. We all worry about it. Be vulnerable, be loving. Look at us. We're 2 college graduates on a YouTube video because we believe that all of you worldwide need to know about these things. You need to know truth, and you need to know how to become a good, functional adult.
yes.
So remember,
Thank you so much.
Talk and all other links that we discussed, I will put in the bottom of this. So if you're interested in PEC or any of those lovely programs that Miss Savannah Harris talked with us about, I will be looking them up, and I will be putting them in the link down below. If you enjoyed, please like, share, comment, and join our Patreon. Peace.
Thanks so much.
Aloha.